Okay, we're plugged in.
Mine's plugged in too, my phone and my computer, so I should be good to go because you said apparently we're recording till 2 a.m.
Yep.
Mama Cheyenne said so.
We're getting this crap done. They want episodes, you get episodes.
Fans demand it. Welcome to Too Much Plaque to Handle. This is 3 months in the making, and we're finally here recording, and we're excited to see where this goes. My name is Dr. Hannah Price. I am a periodontist. I'm a third-year periodontics resident as of right now. I will be done in June of next year, thank the Lord. I did my undergrad in biology at the university, oh my God. I did my undergrad in biology at Clemson University in South Carolina. And then I did my dental training at the Medical University of South Carolina in Charleston. Now I am a third year periodontics resident and will be free and out into the world next year. It's been rough. It's been really rough. But we're here.
Busy.
Very busy. I've had a lot of presentations and a lot of stuff going on. So then I was chief at the beginning of the semester with the new incoming first years, and it was just like scheduling and this and that and all these problems, and everyone's coming to me for answers, and I'm like, I don't even have time to write my patient notes because everyone has been asking me one thing after the other. I'm about to close and lock this door so nobody can come into my office so I can actually get stuff done.
It's been real.
Been real. I've survived. I'm here. We're all here.
Cheyenne, I am a registered dental hygienist. I did my hygiene training at Wytheville Community College, and it's a teeny little town about 30 minutes from West Virginia. There's like nothing there, but they have a really great program and great faculty. I've been a hygienist now for 7 years, almost. It'll be 7 years in May. And now I'm getting my bachelor's in dental hygiene and working as a clinical instructor. I'm getting my bachelor's at Old Dominion University.
Yeah, I've heard of Old Dominion. Okay. Cool. That's awesome. How much longer do you have left on the bachelor's?
4 semesters.
4
4
semesters.
semesters, ideally 4 semesters. I don't know that I want to make it less than 4 because that's with me doing 2 classes per semester. I could maybe do it in 3, but I don't know. That might be a lot.
Well, you're working full time too at 2
Mhm.
offices. So
Yeah.
you've been working at 2 offices full time for 6 years. The same offices or different offices?
I was a dental assistant before I went to hygiene school. The office I was an assistant at, I went back to when I graduated. I worked there for 4 years as a hygienist there, and then I left to go to a different office in my town, but it's a small group, and I work for 2 offices in the group. Have been with that group for almost 3 years.
Okay. And you, what made you want to go to into dental, like when going to dental, assisting school? Like what got you into dental?
Well, my sister's a nurse, and I wanted to do healthcare to some degree, but I didn't go to healthcare first. My original major was sign language interpreting.
Really?
So, of course.
Like 180?
Yep, I was going to Liberty University. It was my like I had just graduated high school, it was my first year in college. They had a sign language major, and I just remember they were doing construction in a building I had a class in, and it was the first week of my second semester, and I went to the bottom of the stairwell, and there's just like all this construction, and I'm just like crying. I called my sister, and I was like, I don't want to do this. I don't think I want to do this, but I don't know what I want to do. Like now I'm stuck. Like
Yeah,
so
what do you do?
literally that day I went back to my dorm and I was just looking up like healthcare jobs, just anything healthcare except nursing, because I've heard all of her horror stories, and I was like, I'm not I'm not doing that. So I looked into like physical therapy, just a lot of different healthcare things, and then dental came up, and growing up I just really actually liked going to the dentist unlike everyone else.
It's like one of the few.
So I really liked going to the dentist, and so I looked at dental hygiene. At the time, The school I looked at, to do prereqs and everything, it was gonna be a couple years. So I started prereqs and did a online dental assisting certification, so there wasn't any hands-on. All my hands-on was office trained, but just to gain an understanding of general dentistry, and took about 2 years and did my prereqs. And while I was an assistant, I had decided I wasn't gonna go to hygiene school. Like, hygiene was my goal first, then I was like, "I'm not gonna go." And then my husband and I started dating, and he was like, "If you don't go sign up for your last, like, 2 prerequisite classes, like, we're done." And I was like,
Oh.
"Oh."
Oh.
And so, because he knew I really wanted to do it, but I just, like, talked myself out of it. Like, I was just really, like, I was scared I wouldn't get in. I was scared, of the unknown. And so I did my last 2 prereqs and applied, got in first try, and I moved and went, and here I am.
You are starting a perio podcast.
Right.
The tables have
So,
cleared.
how have you ended up in Perio, Hannah?
That's a long story. How long do we have? Uh,
Who I am.
yeah, we're gonna need it. Yeah, my story with dentistry is a long one. It started out when I was young. Yeah, my story with dentistry is really long. I knocked out 2 of my teeth when I was a kid. I was about 8 or 9 years old. I knocked out 7 and 8. I was riding a bike and we weren't at home. We were on vacation in New Mexico visiting my dad's business partner at the time. Something happened to where I got thrown off the bike and, I wasn't wearing a helmet, but even if I was wearing a helmet, I wouldn't have saved my face. My face literally went face first into a stump, literally on the sidewalk, like on the side next to the sidewalk. And out came the teeth. So they were fully avulsed, both of them on the sidewalk. I thought I had broken my jaw because my whole body like went into shock. I just remember standing up, probably had a concussion too, because I filleted my face open like it was bad. My dad like came over to me and I remember looking at him like I went, "Dad, I think I broke my jaw." And he's like deer in headlights, look, trying to figure out what the fuck just happened. And I'm trying to figure out, I'm a 9-year-old. I'm like, I don't know what's going on. And all of a sudden, there's blood everywhere. My parents are like looking at my face, and all of a sudden, my mom starts freaking out, like, where are her teeth? Her teeth aren't there. So they literally go back to the sidewalk and pick my teeth up off of the sidewalk. And of course, they're trying to figure out how do we save these teeth. And someone suggested putting them in milk, which that's still kind of, it's not great, but it's something. So the teeth went in milk, and I went to the emergency room very quickly to where they got me in. I was at the ER for probably a solid 10, 12 hours. They took me back, took them a little while to get me back, which was kind of frustrating. But once they did put me under. So I went under general anesthesia and they put the teeth back in and they actually wired everything together. Yeah. So I was on a lot of heavy pain medications for the rest of that vacation. And basically everyone was watching me. I had disconnected and basically smashed all the muscles here. And so I have a scar like right here because all of this like literally flayed open here in the front center. And so that there was a bunch of sutures there and they tried to put the teeth back together and wire it back in. And it kind of worked, kind of didn't work. Because when you're 9, you still have so much growing left to do with teeth and the bone. That was kind of at one of the peak growth spurts for me. I'm very tall. I'm pretty big boned for a woman. So um, it was unfortunate that the teeth they ankylosed and the bone didn't necessarily grow how it should have. So at first I went into braces and they were trying to pull the teeth down, trying to get everything to move. Kind of did, kind of didn't. Obviously they did root canals because they avulsed and they were trying to just save them, do
Yeah.
whatever they could. But then once that happened, they put the braces, the teeth started turning gray and that's when I was like, something's wrong. Then they started getting like really bad internal resorption. They just didn't stay. And actually ended up 7. I was at a dinner for my big it was like a big sports event dinner, and I was eating, and it actually ended up fracturing the whole crown off because it was like a straw. There's no structural stability
Yeah.
to the tooth. So that was kinda like, "Well, there goes my tooth." And then, I ended up getting my first partial, and then I ended up getting a crown, my first crown on the other tooth on 8, and then they were kinda just trying to keep me going until I could get an implant, and that's when they'd already extracted 7 after that fractured, but, they finally extracted 8, but it had been ankylosed, so it was like a pretty traumatic extraction, and so now being a periodontist, like, looking back on everything that I've had done, I'm like, "Man, this could have been handled way better." But, you know what? Hindsight's always 20/20, right? But I got my first implant when I was 18 after they had attempted to do my first vertical ridge augmentation in the front. And so I had my first implant placed when I was 18, and they did a horrific job of placing it. It was when implants were still kind of becoming more prevalent, and it was placed very improperly. And I think it was detrimental to it is because it ended up having to come out. Basically, the implant failed when I was in dental school. I was a first year dental student. I had noticed that I was having issues with it and it was bleeding a lot, which obviously you as a hygienist know bleeding implants are not a good thing. It's really bad when they start bleeding. Yeah. And then they have a 10, 11 millimeter probing depth around it. And that's when we went, yeah, whoops. uh,
Now, question. You said you got your implant when you were 18. Do you recommend waiting later than 18?
yeah,
Because
definitely.
I've always heard later than 18.
Yeah. Yeah, this was a long time ago, and I think this is when, like, implants were still becoming more prevalent, particularly than they are now. They're very prevalent now, but it really is dependent on healing because implants don't move or healing with, your, growth, and implants don't move. It's an ankylosed device, medical device in your mouth. It's not going to grow with your bone, and I think that was part of the problem is it didn't grow and it stayed high, too high. And the crown also was done it was one implant for a cantilever, but it wasn't in one or the other spot. It was literally, like, directly in the middle. It was just, like, very weird placement. Yeah. It looked like a whale's tail flipper kind of thing with the crown. It literally was like the implant in the middle and then the crown coming out.
That is odd.
It was very odd. It was done by, an oral surgeon at a small town oral surgeon who I don't think had that much experience with implants, particularly anterior implants. So, not saying that he really did anything wrong, but his placement really wasn't the best. I think he did what he thought was right with the little bone that I had. And so then it didn't sit well. So now we definitely recommend females be like bare minimum 20 to like completely finish growing at least 20. And then
Yeah,
males
I've
are
heard
even
like,
later.
yeah, I was going to say like 21 has been kind of the common that I've heard.
Okay.
But when you said 18, I was like, that is really early.
Yeah, it was a little too early. And you know what? We live and we learn. That's what happened to me, but then it came out. So imagine poor little D1 me in the midst of exams and realizing, hey, your implant's failing, it needs to come out. And I'm like, okay, cool. So I need like a vertical augmentation. And I go to the perio department and I'm like, can you guys fix this? And that's how I really learned what perio was and what all it entailed and what kind of surgeries they do and how meticulous they are is because they did multiple grafts on me. The first one, they did a big vertical ridge augmentation with a titanium reinforced like PTFE membrane, which needs good passive primary closure, and unfortunately, it started coming undone, and it got infected. This was also a time that Charleston was under a hurricane, and we had to have evacuations, mandatory evacuations. The saga continues. When I tell you I've been through the ringer with my teeth, I have been through the ringer.
You have. Like, it was a bike and a tree stump, and my teeth are on the sidewalk, and an implant failure, and this and that, and a hurricane.
This is the first one.
My gosh.
Oh, mandatory evacuation clinics are closed. I have extreme, like, pus coming out of my mouth infection with this bone graft, like, blood everywhere on 2 rounds of antibiotic. Like, they just need to take this thing out. The clinics are closed. Like, what do I do? I literally
Yeah.
was like, I was stuck. And so I finally, once everything opened back up after the hurricane, we went back and they opened it back to clean everything out. And it was probably the most traumatic surgery I've had because I was so infected that the anesthetic wouldn't work. My poor roommate at the time was also a D1. And she's like, I want to watch your surgery because you get experience when you rotate through clinics, and she could get experience, watching my surgery. I think I scared her half to death. She was like, I am never going back to perio ever again. That was the worst experience of my life. You were crying. I was crying. I was holding your hand. The numbing wasn't working. The sedation wasn't working. They were like tacking and like hammering into my face. And they're like, oh, she was, I think, scarred for life.
She's probably like, how did you even go to perio after that?
When I tell you I have had it all, I know everything. I have had it all done on me. Because then after that second augmentation, I then had to have a free gingival graft because of the tissue that I was missing. I had no keratinized tissue, and we had to do like a vestibuloplasty, so to deepen that vestibule there in the anterior region. And so I've had an FGG done, and I can tell patients, listen, this is what it feels like. I personally have had it done on me, but
I
that
think,
was
though, some of the best providers, I think, have had that experience
Mhm.
because how can you really, especially on the surgical side, like there are a lot of periodontists, oral surgeons, and stuff that haven't had half of the stuff done to them, but they're doing to other people. So to have that perspective, I think that probably give patients more peace of mind to
So,
understand it from the perspective of someone who has literally had it done.
and I feel like they can take my word for it a little bit better because it's not just a provider saying, "Yeah, you'll be fine. You're good," or "This is what to expect." I'm like, "No, this is what to expect."
What's the podcast going to be about? A lot of perio,
A lot of perio, a
a
lot
lot
of
of dentistry.
dentistry, misinformation, crazy stories, Reddit stories.
Reddit stories. But then I think too, the lists that we have of ideas and even just guest lists that are non-dental related but can apply, I think will be a fun time.
Yes, yes, I do agree with that. We've got a financial coordinator on the list. We have a hygienist who owns a practice, actually. She's on the list.
Her
We
dad is the financial coordinator.
Her dad is the financial coordinator.
CC
Oh,
dad.
CC dad. CC daddy. So we got the plug with that. We have a physical therapist who is a specific physical therapist for dental providers
As a periodontist, why does dental health matter?
because periodontitis can give you erectile dysfunction.
It really can. The list is so long. Like, the public has no idea. They
No.
really don't. They have no idea. And I've had so many people even, like, say someone needs dental clearance for organ transplant, like something like that. And then, they're at the dentist office and we're looking at this and we're like, you have so much widespread infection. And they're like, okay. And I'm like, you have infection everywhere. And then they'd be like, well, my medical doctor didn't say anything about it. So and I'm like, in medicine, they don't learn dentistry.
This is the disconnect, and we need to do an episode on this. This is the disconnect from dental world and the medical world. Dentistry is medical, severe medical, to the point where I literally last week had to stop a shoulder replacement surgery because this guy is full of perio and
Yeah.
infected implants like pus infection. He's like, well, my shoulder surgery is scheduled. I'm like, no, it's not. Like, you're gonna have to reschedule it. I mean, I'm like, I don't know what you want me to tell you right now because you're not cleared to go get a joint replacement because it can cause the joint replacement to fail. It's like the
Yeah.
bacteria, your mouth is not Vegas. It does not
Mhm.
stay in your mouth. It goes all over your body.
It is so wild. Like, especially, so my sister being a nurse, she hears me talk about dentistry all the time. And she watched me go through hygiene school and she was like, oh my God, what is this?
That's
Because,
interesting.
I mean, The didactic was, like, off the charts. She's seeing all the course load I was taking, what the course load was, and she was like, "What on earth? Like, what the heck?" And then on top of that, finding my own patients, and then the patients have to meet this rigorous criteria, and she was like, "This is insane. I had no idea that this would ever be like this." So now she hears all this stuff about dentistry all the time and sees all of it, and she works in ICU. And I've told her, I'm like, people that have periodontitis that get intubated are at a much higher risk for pneumonia because you're just shoving that bacteria straight to the lungs. And she's like,
Yummy.
I don't know why we don't learn any of this stuff. And I'm like, well, it's not just nurses, it's medical doctors
It's
don't learn it.
everybody.
Yeah.
Yeah.
It's like you only learn anything about dental if you are a dental professional. But dental professionals learn the whole body. It
100%
doesn't
true.
make any sense.
100% true. We literally in dental school, we take almost almost all the same didactic classes, like basic science didactic classes that medical students take. We take the same cadaver labs, we do the same cadaver dissections, we do the same pharmacology. Our professor literally went from our classroom to the med school classroom, like directly after, and like the same micro immuno. We have different pathology because the mouth pathology is a little different, but then we also have to learn about pathology in the rest of the body because a lot of the first manifestations of
Or in the mouth.
cancer are in the mouth. And a
Mhm,
lot of medical doctors don't know that. They don't know
mhm.
that breast cancer will literally manifest in the mouth prior to them even seeing it. It's like or prostate cancer is a big one. Prostate
Yeah.
cancer is a huge one that will see lesions in the mouth from metastatic cancer that is not even on the doctor's radar before they could
Mhm.
even really diagnose it. And it's like they don't understand that correlation, and it's so frustrating.
And I'm like, "This is healthcare, and you can die in a dentist office. It's not
Oh, 100%.
common, but we try to do everything to prevent it." Dental health is just so lacking for the public because they don't find importance in it. And that's why I think too it's correlating all the things that have been to it with the different types of cancers, Alzheimer's, just so much that is affected by it.
Let's do my camera. There we go. No, 100% agree. 100%.
So dental health matters.
Yes, yes, it does. Dental health is so much more important than so many people let on
What's coming next?
episodes.
This topics we've got all things perio because
Oh, it's very
the world doesn't know what perio is. So all things perio. A lot of dental stuff. There is a lot of dental stuff and a lot of not dental stuff. I'm really excited for the Reddit stories.
I am too.
It'll be educational and a fun time.
Absolutely. But as we know, perio goes so much deeper and there's a lot more to it. It's a killer, literally. Silent killer.
Um, we
But
learned
it's
to
silent killer.
low birth weight babies, preterm labor.
Mhm. And so I'll just give a little background on perio because hygienists obviously they treat perio, but being a periodontist, I'm a surgical specialist in the dental field. So I'm doing an additional 3 years of residency on top of dental school where we really specialize in the periodontium, which is your bone, your soft tissue, and the ligament that goes around all your teeth. And we obviously do disease eradication with periodontal disease. It's one of our number one things we treat in all the surgeries, perio surgeries that we do, which is why we are very close friends with our hygienists and those referrals. Once they've exceeded a certain scope of practice, come to us. So we have a very, very close relationship with hygienists and just being able to understand how we work together, how we refer. And that's kind of why we wanted to start this podcast is to talk all things perio and see where it takes us. Right.
Yep. You get perio from a periodontist, perio from a hygienist. So you're gonna learn it all.
It's very different perspectives. Everyone's got a different perspective. Especially when you have a hygienist who treats mostly I mean, they don't do the full, like, gum reflections that we do, but they still treat very severe cases, and in Cheyenne's case, I know that you treat a lot of very advanced perio because you don't have a periodontist in your town.
So yeah, if you want more of this, just go ahead and subscribe.
You want more of this unhinged perio talk, hit that follow button, hit that subscribe. We'll be dropping episodes every couple weeks. Obviously, life is life, and she's in school, I'm in school. We're not full-time podcasters. We are full-time dental providers, but we're on here because we think it's gonna be fun. But we love what we do. We have a passion for what we do, and we want to share that passion with everybody else. And we want to counteract some misinformation that's all over the internet, and particularly TikTok. And we also want to just spread the good news of perio. What? That's
It's great. It's like winning the lottery.
Duh. They get to talk, they get to see us. That's funny. That's a pretty solid ending.
Y'all have a good night, everybody.
Feels weird when we're not really talking to anybody.
I know. I'm like, how do we actually end it? It's like, do I say bye? Do I?
Peace out, Girl Scouts.
Works for me.